Today I will be discussing few common questions which are usually asked by the patients and searched on the Google commonly about the kidney transplant. I am Dr. Dilip M. Babu, consultant nephrologist and transplant physician at Yashoda Hospital, Somajiguda, Hyderabad. So we will discuss few of these questions and hopefully it will answer most of your doubts. So most of the times people ask when we should plan for kidney transplant. Most of the patients who are diagnosed with chronic kidney disease, like chronic kidney disease means permanent kidney damage. So when the kidney damage is not reversible, these patients will have two options. Either they have to do lifelong dialysis or they can opt for a kidney transplant. So next question what comes is who can donate the kidney? So most of the patients will ask where should I get the kidney? Most of the times we choose live donors. Either they are relative of the patient like mother, father, brother, sister or husband, wife. These are legally allowed donors who are having the same blood group as the patient's blood group. Or the donor's blood group is O, he can donate the kidneys to anyone because O blood group is a universal donor. Or it has to be the same blood group as the patient. That person can donate the kidneys. Usually the donor should be age approximately less than 65 years and the donor should not have blood pressure or sugar or any other major health issues if they plan for kidney donation. So next common question what they will ask is or they will search on Google is what happens to the donor? If he donates the kidney, what is the risk for the donor? Usually whoever people they donate the kidneys, majority of the patients they are 99% they will not have any health issues in future because before donation only we do all the tests, all their fitnesses and then plan for kidney donation. So after donating kidney their health will be as normal as any other person and they need not have to take any medicines. Usually the hospital stay for donor is 2 or 3 days and within 7 days they can be as normal as any other person and they can do all their activities like lifting the weight or their diet will be the same as previous. Only thing we advise in advance for all donors, they should do their health checkup at least once in 6 months or year and consult the doctor. So kidney donation is very safe and 99% people will not have any health issues after kidney donation. Another question usually they ask, which is best, whether dialysis or transplant? Permanent kidney damage patients, what we call as chronic kidney disease, they always think whether should continue on dialysis or undergo kidney transplant. Out of these two options, kidney transplant is the best option because after the kidney transplant, their quality of life is much better compared to the dialysis. As we all know, the patient has to undergo dialysis weekly twice or thrice. He has to go to the nearby center and do the dialysis. If after kidney transplant that kidney is accepted by the patient, then his creatinine will become normal, his all other health parameters improve and his quality of life as well as the survival improve. So people who are on dialysis, stays on dialysis, they have less survival compared to the people who undergo the kidney transplant. So that's why kidney transplant is always better compared to the dialysis. Next, another questions they ask whether they remove the native damaged kidneys before putting a new kidney. So this is a common question asked by the patients. So usually during kidney transplant, we don't remove the old kidneys which are damaged from the patient. We only put one extra kidney. We take it from the donor and put it in the lower part of their stomach and we fix the new kidney in that area. And we usually don't remove the old kidneys. Only in cases like if the old kidneys are having stone or infection or very large kidneys as it happens in polycystic kidney disease, we remove the old kidneys. Otherwise, we never touch the old damaged kidneys. Next question is, which is cost effective, whether dialysis or transplant? Patients usually think kidney transplant is a very costly procedure compared to the dialysis. But if you really calculate the cost for dialysis, it is quite higher. Even most of the areas we do dialysis free of cost, but still patient has to get recurrent costs for their fistula failure, their access, the catheter infections, they have to take multiple admissions in the ICUs, they will require long stay, they will require antibiotics. So all this will go on adding their costs. So on an average, they have to take multiple BP medicines, cost for admissions in ICUs. Plus some people, they don't have dialysis center at their place, they have to travel far away from their native place to undergo the dialysis. So overall cost, if you calculate for dialysis, is much higher compared to the kidney transplant. As we know, kidney transplant is a one-time cost expenditure for the patient, but usually after the kidney transplant, their cost will significantly come down, plus their quality of life will also improve. Next common question is, what are the complications or what care they should take after the kidney transplant? So usually patients who undergo kidney transplant, once their body accepts that kidney, their all parameters, creatine, most of the times blood pressure will also become controlled, well controlled with fewer medications. But after kidney transplant, they have to take care of their new kidney. They have to control their blood pressure, control their diet, control the blood sugar also, so that new kidney will work for long. If they don't take medicines, they don't take their immunosuppressive medications. What medications usually we start after kidney transplant? 2 or 3 tablets will be there. 3 tablets, tacrolimus, mycophenolate, steroid. These are the type of medicines which is called as immunosuppression medications. These medications patient has to take rest of their life. If they stop these medications, then body will react against the new kidney and the rejection will happen and they will come back to the dialysis. So all transplant patients, they should take the medicines properly and regularly follow up with their doctor. Another problem after transplant which commonly we see in our country is because of infections. Because of these medicines, whatever we start, their body immunity will be very low. So with low immunity, they can easily catch the infections, lung infections, urine infections, tuberculosis or fungal infections. So they have to take care of their health properly. They should avoid the crowded places. They should wear the mask. So these general precautions to avoid the infections, all transplant patients should take. Otherwise, sometimes these infections are very dangerous, life-threatening also. Next common questions is, what immediate complications can happen after the kidney transplant? So this is another question ki after the surgery immediately usually what complications can happen. So usually after the transplant, the patient is kept in a transplant unit for approximately 7 to 10 days. During these 7 to 10 days, patient is closely monitored for complications like leakage from the blood vessels, leakage from the urine tube, or whether they are getting rejections, like if the creatinine is not coming down or urine is not coming. So these are the usual complications immediately after the transplant, like rejections. We monitor them for infections because these patients are on immunosuppressive medications. 95% cases, it is a successful. 5% cases, it might be a risky because of rejections and infections. And few of the cases we have seen the original kidneys, whatever the reason it has damaged, sometimes the original disease might come into the transplanted kidney. So this is called as recurrence of the original disease. These are the few complications, but overall success rate is 95 to 96% patients. They do very well after the transplant. Kidney patients should plan for the kidney transplant compared to the dialysis. These are the common questions what usually patients with chronic kidney disease will have, and probably most of these queries has been answered, but if any queries are there, you can contact us in Yashoda Hospital, Somajigoda, Hyderabad. I am available there, so you can connect with us for your further clarifications or any doubts about kidney transplant. Thank you.